In this video, we're going to have a look at how you might use eCare during your ward rounds. Generally speaking, it will be much easier to find your patients for a ward round from some sort of list. This might be a location-based list, a consultant or specialty-based lists, or it might be one of the care team lists, for example, the medical take list or your team's on-call list. There are various views available for any patient list, but probably the most useful one for doctors conducting a ward round would be the doctor's worklist view, which is what we see here. Now you can have less columns visible on the screen, which has the advantage of making them bigger. Indeed, you can select which columns you would like to see here, and also by clicking and dragging up and down, you can change the order of the columns. This means you can end up with a view that is appropriate for your specialty and the way you like to work. Let's just have a look through the work list to be clear what everything means. In this first column here, I have level 1 pathway. If the patient is on the level 1 pathway, then a 1 would appear in this column. The second column represents allergies. At any time, if you click on these icons, you get a message telling you what they stand for. We have patient details. These are all test patients. Details about length of stay, the lead clinician, and this is something that you can have turned on or off. You can have it to show the assigned nurses or the consultant. If I want to display the clinician, I click here. In this column, we see the illness severity. Now, the Trust intends to use the 4 illness severity categories. They can be seen by clicking here. For unstable, watch, stable and discharging as a proxy for the 4 standards of review required in the 7-day working standards. Next, I have the location of the patient, and for a ward round, would probably want to order the patients by this column. The next column tells me if there are any outstanding actions. The number indicates the number of actions. If I click on here, I can see that this patient needs the hip and knee plan, bloods chasing and checking of consent, and that this particular consultant requested that on the 4th of April at 1:33. The following column tells me the patient's latest early warning score. The next 2 columns show me whether the patient has been clerked and whether they've undergone a post-take ward round. These columns are particularly useful if you're dealing with acute admissions. Next, we have the predicted date of discharge, whether a dementia and delirium assessment has been completed, whether there are any alerts for sepsis. So here we can see that this patient has red flag signs for sepsis. Similarly, whether there are any alerts regarding possible acute kidney injury. For VTE assessments, an up arrow like this indicates a patient has been assessed and is at risk of deep vein thrombosis. In contrast, a downwards arrow shows the patient's been assessed but is not felt to be at particular risk. If there's nothing in this column, then the patient's not yet been assessed. We then have problems and diagnoses. Diagnosis will be the reason for this admission. Problems will be other related issues, comorbidities. The work list can only show 2 problems at any one time. If there are others recorded, then you'll see a number here telling you there are 2 other problems for this patient. And if we click here, we get to see the other problems. So as well as the COPD and the hypercholesterolemia, this patient has hypertension and safeguarding issues. The diagnosis is fairly self-explanatory. And the final column shows me the resuscitation status for the patients. So the heart-shaped icon means the patient is for resuscitation. DNR stands for do not resuscitate. And again, a gap in this column means nothing's been uploaded. So the list is quite good at showing you what things still need to be done. If we take the example of a board round, this view is also quite useful. And in addition, if we were discussing the first patient, by clicking on this small arrow here, a tool called iPass opens. This doesn't directly form part of the patient record, but it can be very useful for handover. It's one place where I can change the illness severity simply by clicking on the relevant box. I can enter a very short summary here. The aim of this wouldn't be to duplicate the medical record, but you might record just brief highlights for handover, the sort of thing currently recorded on ad hoc bits of paper. Any actions required can be put in here. Saved. And it's these actions that populate the action column on the work list that I already showed you. The second tab in here, which again I think could be quite useful for board rounds, gives me a brief summary of the patient's current clinical status. It shows me the last set of vital signs. In the live system, it would show me recent lab results, an overview of the patient's medication, and the current state of their fluid balance. Finally, this is one place where I can associate the patient with the care team. The way I would do this would be to click plus and then assign clinical staff team. Now get a list of the available care teams. If this was someone I was worried about perhaps and I wanted to make the hospital at night team aware, I could associate them with that list simply by clicking on the list and then saying assign. Anyone now looking in iPass will be able to see that this patient is associated with the hospital at night, and any staff that opt in to the hospital at night team, care team, will be able to see this patient on their list along with their record if they require it, or the abbreviated summary in iPass. By clicking on the cross, we return to our work list. Now, if I'm actually going to see the patient, and I'm going to want to have a bit more detailed assessment of them and record my findings. I would click on the patient's name, and I would be taken initially to the clinician workflow. You'll remember from your training this is very much an overview of the patient's notes. This patient had already been clerked and had a post-take round, so I would go to the progress note. Now, particularly if I have a widescreen monitor, which you will have on the WOWs, you may find for the purposes of a ward round it's useful to split the screen so that you have easy access to information about the patient at the same time you're creating your note. You'll see this arrow to the right here for the boxes that are available to be moved to the right hand side of the screen, like so. If I just scroll down to the places where I might record, you'll see that one by one they are moved to the right hand side of the screen. Might seem a bit slow to do this, but when I'm working from a list, subsequent patients I go to will maintain this view within the progress note or the post-take note. So it's something you'd only have to do at the beginning of the ward round. So I now have a 2-column view. Remember as well that if the remaining columns are not really feeding through in the order that's most helpful to you to conduct your ward round efficiently, you can simply move them by dragging and dropping here. So returning to our patient, I can see from the banner bar he has a predicted date of discharge of the 11th of April. If I wanted to change it, or if he did not have a predicted date, I would click here to enter that. By clicking on the second box, I get to enter the name of the most senior clinician for this encounter. So typically the consultant or middle grade doctor leading the round. When I've entered that, I just need to sign it. So the reason we're reviewing the patient, I could say, is the daily ward round. If I move down the list, I can see that this visit, this patient, has a myocardial infarction. Other chronic problems are COPD, hypercholesterolemia and hypertension. Obviously, in a demonstration system, not all the sections are populated, but in the live system, if the patient was having regular observations, there would certainly be something in the vital signs box. If I go back a bit further, here we go. This patient did have some observations entered on the 28th of March. So I can see those. Similarly, if it was being measured, I would see a summary of the fluid balance here, recent lab results, diagnostics, orders for the patient. I can see what's been done, what hasn't been done, and then documents that have already been created. Looking down here, the most useful one for the purposes of a ward round looks like the clerking from yesterday. By clicking on that, I can open it. I can have a quick look at the clerking note. You can see the patient presented with central crushing chest pain, a bit of the history, systems review and examination findings, along with an assessment and plan. If there was anything in any of the documents that I think is particularly useful and I would like to reference in the note I'm creating, then I could select and tag. That text has now moved onto effectively a clipboard, indicated up here that we have tagged items. We'll come back to that in a minute. Once I've finished with that, clicking here, I could open any other documents I want to. I can review the medications. So we can see this patient's scheduled to receive dalteparin. We can see in the last 24 hours they had some cyclizine and morphine. We could, of course, go to the full drug chart. This gives us a summary. If I want to place orders for more tests, drugs, etc., I could do that here. I can also see that this patient's already been associated with the medical take list care team. If I wanted to add to other care teams or remove the patient from this list, I could do it from here. If the patient's had imaging, then the text reported result of that will come into diagnostics in eCare. But if I would like to see the imaging, then I would need to go to Insignia Packs. Clicking on the icon on the toolbar here will take me to this particular patient's Packs folder, from where I can review any of their imaging. All that remains is for me to create my note. I can write as much or as little as I feel appropriate. You'll note I'm not writing anything in these last two boxes. None of the boxes are mandatory. They're there to facilitate you writing as much or as little as you feel appropriate in them. When I've finished, I need to create the actual note. Initially, I get to preview this. You will see, in addition to the things that I've put in, the note has pulled in the fact that we've had a quick look at his problem list, his current medication, his normal home medication, a little bit about the history. I can edit any of these boxes. Any boxes that are empty, I don't need to delete. They won't pull through into the view of the note that you're going to create. Now on the left here, you can see that text that I tagged. At this point, I can drag that into any part of the note I want to. There it is, and you will also see it referenced. Down at the bottom here, you can see where that information comes from, who wrote it, and when. Once I'm happy with my note, I sign and submit it. Defaulted to a progress note type. I have the opportunity to give it a more detailed name as well. I sign it. So now anybody else coming to review the patient can see that note. And that's the same whether they're in the clinician workflow or the nursing workflow. Once we finish for the patient, remember we were working from a list. I could click up here and go to the next patient in the list. It's now opened the next patient. If we return to clinician workflow, progress note, you'll see it's maintained that two-screen view. Now there will no doubt be other ways in which you can conduct your ward round, but I think this will make you get the most efficient use out of the dynamic documentation